Joining us now is Ujjal Dosanjh. He is a member of Parliament for Vancouver South, and he served as Canada's Minister of Health. He's also at the CBC in Vancouver. Thanks for joining us today.
Good to be with you.
And I'd like you to address what we just heard from Dr. Day. Specifically, this would be one of the areas of concern, I think, for a lot of Americans looking at Canada's healthcare system. Dr. Day just said many Canadians can't get a family doctor and therefore can't even get access to specialists. Why would that be? And why is that a problem with the system?
I think that in the Western world there is a doctor medical shortage. The United States of America is much better at integrating international medical graduates than we are. We import doctors as well as training them here. We lose some of them to the United States for private practice. There's absolutely no doubt about that. So we could learn something from the United States of America in terms of integrating international medical graduates into our system. There are many of those people who come from other countries and aren't able to practice here. In fact, many of them find the opportunity to practice in the U.S. But I believe that in terms of doctors, the statistics might be different. I was just reading a poll the other day. It said one out of every 10 Canadians doesn't have a doctor. 1 out of 7 is bad. 1 out of 10 is bad. But if you compare that to, I'm now knocking the American system, but if you compare that to 47 million people without insurance who don't have the ability to go see a doctor quite often, I think that what it says is that we need to improve our system. It is not necessarily that we follow the U.S. or some other system, but we need to improve our system, improve access. There's no question. In some instances, there's a long wait to see specialists. Primary care and urgent care in Canada are extremely good.
All right, let's take a call now. We're going to go to Julia, and she is calling from Ontario. Hi, Julia.
Hi.
Go ahead.
I'm a U.S. citizen who has lived as a permanent resident in Canada for 22 years, and I am a breast cancer survivor, had all my treatment in Canada, never had to wait any extraordinary or exorbitant period of time. The care that I got was completely comparable to the care that friends and peers in the United States who are also breast cancer survivors that they received. It was entirely comparable. I never paid a dime or a dollar for anything other than for routine prescription medication because I do not have a supplemental drug plan. It's true that Canadian health system needs to be better funded. We do need more specialists, but I wanted to point out that the commercial with the woman with the brain tumor is entirely misleading and biased. And everyone I know, and I know a great many cancer survivors because I've been involved in a number of ways in that community, everyone I know has been entirely satisfied with their care. You are pushed to the front of the line when you have a serious condition.
Okay. Julia, thanks so much for calling and giving us that perspective.
Thank you for taking my call.
I appreciate it. And, again, maybe this is something else that we can address, and that is what we hear so often, what we heard in that commercial, the idea of waiting times. There is a reality to that, though, isn't there, Mr. Dosanjh, that sometimes you do have to wait quite a long time for certain procedures or certain tests?
Well, for elective surgery, there are long waits. For urgent surgery, sometimes there are waits, quite often not. I think there are waits to see specialists, inordinately long sometimes, and I think that needs to be dealt with. There's no question we need to do a better job. I think that it's not about changing the fundamental nature of the system, which Canadians cherish. It is in fact making the improvements that need to be made with specialist care, with wait times, with prescriptions. When I was in government, we were talking about the possibility of a national national pharmacare plan. We now have some provinces have better pharmacare plans, others not so much. Have the capacity to provide those kinds of prescription plans. We need to include dentistry. I think those are the kinds of issues that perhaps are being discussed now around the federal provincial table with the ministers of health from across the country. If they aren't, they should be.
All right, and here is an email from Richard in Ann Arbor, Michigan. He says, Canada has a population slightly less than that of California. Extrapolating to a population 10 times as large is dangerous. Do you agree with that, Mr. Dosanjh?
Absolutely. I think one of the earlier callers made the point that we have a 33 million population, and sometimes we can't provide all of the boutique and specialized care because we just don't have the resources or the capacity to be able to have every kind of procedure available in Canada, and we send patients at government expense to the United States of America. You're our kith and kin, are our best friends, and we take advantage of that and pay you for it. I think that may be in the long run, in some cases, cheaper than developing native facilities in Canada, because you can't really do everything with the base of 33 million population.
We're talking with Ujjal Dosanjh. He's a former federal minister of health in Canada. If you'd like to join our discussion about the Canadian healthcare system, the number to call is 800-989-8255. And you're listening to Talk of the Nation from NPR News. We're going to take a call now. We're going to go to Rebecca, who is calling from San Mateo, California. Hi, Rebecca.
Hi there. How are you?
I'm good. Go ahead.
I just moved to San Mateo about 2 years ago. I was living in Toronto. First of all, I'm a dual citizen, grew up on the East Coast. Lived in Toronto for 10 years, and in the course of those 10 years, countless emergency visits for primary care type things. Never had to wait more than 45 minutes any given emergency room in the downtown Toronto area. I was also hit by a drunk driver on my bicycle and had to be taken by ambulance and spent a day in the hospital, was stitched up, received MRIs, saw specialists. Everything was taken care of. I know that there is a population difference, and that is one of the biggest arguments that Americans have against the Canadian system. And I grew up in the States with American relatives, and we were constantly battling two sides, my Canadian mother and father and my American family, battling this healthcare issue for years and years. I've come to California now, and I cannot get insured because of that accident I had in Toronto, because I was honest about the chiropractic care that I did receive. A bulging disc that has been taken care of is preventing me from getting health care that I can afford here in California. So the only thing that I can rely on, go on, I'm sorry.
Go ahead. I was just going to ask Mr. because we're going to be running out of time soon, Rebecca, and we want to get some more calls in here. I was just going to ask Mr. Dosanjh to respond to some of the remarks that you've just made. Thanks for your call, Rebecca.
Well, I think that highlights the fact that Canadians, by and large, get very good care without their wallets being checked at the door of the hospital. And I believe that the other point Rebecca raised with respect to the uninsurability because of previous injuries or conditions makes the point of the importance of having government as your ultimate insurer. In Canada, it is the government that is your ultimate insurer for primary care and urgent care. And hospital treatments. Yes, prescription medicine isn't available based on the same standard across the country. I think that's something we are working towards. It is on the table of the federal provincial ministers' meetings. When I was there, it was, and we were trying to develop a plan.
I'd like to read an email. We don't have much time for this, but I'll summarize it. It's from Tom in Juneau, who says he has friends in Quebec who say that when forced to take their ill daughter to hospital, the situation is a 19th century one. People in beds and hallways and in very large rooms with perhaps 24 patients. What and says this is very different in a city nearby for them, at Whitehorse, which is near to them in Juneau. So there's a great variation among the provinces, is there not?
Well, yes, there is, and there's also hallway medicine in the sense that sometimes hospitals don't have the facilities to treat everyone that's there. That again is a question of resources. resources, not about the nature of the system, but about the resources. And I think we need to enhance those resources, streamline the processes that we have in the hospital, triage the patients, and do so in a more efficient fashion. As I said, when I was the Minister of Health, I was taken to various hospitals across the country that are continuously sharing best practices, and we could learn.
Thank you so much for joining us, Mr. Dosanjh. We've run out of time. I really appreciate it.
Thank you.
Ujjal Dosanjh is the former Minister of Health.